Hi, Mercy. My name is Dr. Danson Macharia. I'm 42 years old, and I've been hospitalized in a private hospital here in Nairobi now for the last 14 days. I was hospitalized after having traveled from West Africa. I arrived in the country on the 23rd of March, and upon arrival in the country, I found that the government had instituted these mandatory quarantine measures. So directly from the airport, I was directly transported to one of the quarantine facilities where I stayed for 7 days. And during that stay in that facility, I was subjected to the COVID-19 test. It so turned out that the test came out as positive on the 7th day. And as a result of that, I was transferred to a hospital facility to be kept in isolation and for further management in line with the government policies. So I have been in this hospital, this private hospital, in isolation for the last 14 days. Basically, I have been asymptomatic, as we say, meaning I've not presented with any signs or symptoms of illness. And as you can see, I look like a very stable person who perhaps doesn't even warrant to be in a hospital facility.
Like what are you doing in a hospital? You should be at home. You are kind
exactly.
of for home-based care.
Exactly. But I've had to comply with the government policies. Every day I keep asking myself, what's the whole purpose of being in a hospital? But nonetheless, I have to be an obedient citizen of the country and follow the guidelines and the policies that the government has instituted. Today is my day 15, actually, in hospitalization. And as per the government policy, I was to be subjected to a retest yesterday. Yesterday was the 14th day of my hospitalization. And all positive patients who are in isolation expected at least to be tested on the 14th day, just to check whether, for those who've been on treatment, whether the treatment has worked and the virus has been eradicated. And those who have just been on conservative management like myself, whether my immune system has been able to combat the virus and eradicate it. And obviously, based on the results, one would be expected to, if the results come out negative, one would be expected to have a repeat after 48 hours. And if indeed the repeat comes out as still negative, one would be discharged. It turns out for me that unfortunately, despite everything, my test remained positive yesterday. It was much of quite a shocker, and I was very disappointed to learn about it. But nonetheless, I've had to actually comply with the requirements and remain in the hospital. Yeah. So this is where we are now.
Yeah. Pole sana, you have to go through this. I know it has been quite a rough patch. How is it being in the isolation facility? People think maybe a private facility is much better than those of our citizens who are in public facilities. How is it like in there?
To begin with, I want to talk on based on my own experience. I have been in a private facility where at least the facility has done its best to comply with the best quarantine measures, meaning they have the best hygiene standards. They have, as much as possible, put in place the necessary spacing between the patients. They have ensured that there is minimal sharing of facilities, and they have made sure that healthcare workers are also well protected with the necessary protective, personal protective equipment and garments that they are supposed to dress up with while coming into contact with patients. So generally, I would say the hospital has tried its best. The only drawbacks that I have, my immediate reservations about being in this particular private facility has been the fact that we have all been kept in an open ward. At the very beginning, when I was admitted, we were all hospitalized in a 7-bed ward. Different people, there was really no stratification or separation of patients based on the severity of illness. As I came in on day 1, I was asymptomatic, and I've remained asymptomatic, as I said. And I happen to actually have been the second patient in that ward. I found another gentleman who was in the process of getting better at the time when I was coming in. After a couple of days, somebody else came in. He was actually somebody who was actively sick because he had a mild fever, he had a cough, and he was kept about 1.5 meters away from me, okay? That obviously was a cause for worry, and especially for me, and especially with the conviction that perhaps my body did not have the virus, you know, in view of the fact that I was not presenting with any symptoms. So having somebody next to you who is actually going through an active disease, somebody who is coughing actively, or somebody who is running a fever, as would be the typical presentations of this disease, would really worry one, and would one would really wish that perhaps they would be moved to a private location away from maybe an infectious case. So I think that's one major issue that is worrisome, and especially to anybody who knows how infectious this disease can be, you know, how it is spread from person to person, or from surfaces to individuals, or from sharing of facilities. So I felt that was not right. Secondly, in as much as it is a private facility, there is still sharing of facilities. By that I mean, over and above sharing a common room, bathrooms are being shared. Whenever the healthcare staff come to take the vital signs, you'll definitely notice that, for example, the blood pressure and the vital signs machine that they use to undertake those measurements is the same one, and it's moved from patient to patient. Fine, you can always see that they try their best to sterilize the various parts of that equipment before they move from one patient to another. But I want to, in particular, mention the blood pressure cuff.
Yeah.
You know very well, we're advised that whenever somebody coughs, you're supposed to cough onto your elbow or thereabouts, or your forearm. So when you cough here, that is where you deposit the virus. Now, this is the same location where the blood pressure cuff is usually placed, okay? So if it is not adequately sterilized, there's a very high likelihood of transmission of infection from one person to the other. That's one consideration that perhaps I wanted to throw across to especially the infection prevention team to take into consideration, and perhaps could be a reason why people could be spending longer infected, because they're sharing out the virus in an open facility. So there is need to observe very, very strict triaging policies and infection prevention policies. Secondly, I also want to say that psychologically, it's very draining being in a hospital facility where you're limited to only about a maximum of 400 meters movement radius. So you can only leave your bed. Yes, it's a very minimal distance, and you cannot really even get outside of the room. The best that you can do is look through the window, maybe go to the reception area and stretch. There are no recreational facilities, absolutely no recreational facilities. So if you're a person who is engaged actively in sports, you will have to be creative on how to actually continue with your normal lifestyle.